So welcome everyone. It is just 12 o'clock here in Eastern Standard Time. There were a lot of people who registered who I think are still figuring out how to log in. So we don't want to start too quickly. We're going to start maybe in about like a minute and a half, minute and 43 seconds, something like that. My name is Yona, Lunsky, and I'm one of the people from the team who's going to be speaking with you all today, and we're so excited that you're here with us. If you have any questions, issues, can't see, can't hear, use the chat box because we are actively monitoring that and trying to respond. But once we do talk, I will ask, try not to have too many sidebar chat conversations. We want you to be able to attend to what we're speaking about. And also just so you know, us, the speakers, cannot see the chat box. So we won't be able to respond to those kinds of questions and discussions as they're happening. We'll just be focusing on what's on the big screen. So yeah, another minute or so. Any questions, let us know. Super excited that you've joined us, and I can mute myself again. So welcome everybody. We're super excited for our first of 4 in our webinar series for families. Today's talk is Communication, Empowering Family Caregivers to Improve Healthcare Communication. This is our team, and soon we'll hope to find out who some of you are. Maybe we'll start this way, introduce ourselves.
So my name is Irfan Jiwa. I'm a MD by training, but I'm a sibling as well of a young 14-year-old boy with autism who is the current love of my life, I would say, and has inspired me to be where I am right now, working in healthcare. Right now, I am a research analyst working with Dr. Yona, who's going to introduce herself in just a moment. And I'm really happy to be here and share some insights around some great tools that we have to help people communicate better.
Great. And I'm Yona, and I also have a sister who I love very much, although she's older than your brother. And I also work in the field of developmental disabilities, and I direct the Azrieli Adult Neurodevelopmental Center.
I'm Lunsky, and I'm also a parent of a young man who's diagnosed with autism and a developmental disability when he was a youngster. And I have the privilege of working with Dr. Lunsky as a family advisor here at CAMH.
All right. So we've already done our introduction. So one thing we can check off the list, which is awesome. The other things we want to cover today, we'll talk about why this issue of healthcare sort of engagement and communication is so important. And we're going to go through 2 tools that we developed together with folks from the primary care developmental disabilities program at Surrey Place, as well as our colleagues who work at Vita Community Services here in Ontario. And we're going to talk a bit about why these tools matter when it comes to families. And then we'll leave a bit of time to talk a bit about some of the challenges you might think you would encounter using tools like these, and we'll offer a couple of strategies, and then talk a bit about some of the next steps. So hopefully people are doing okay with their connections and that kind of thing. We like to keep these things interactive. There's always a risk when you're online that people just kind of disengage. So we're going to do a poll, everybody. So the first poll is popping up on your screen. Don't panic if you don't know how to respond to a poll online. But if you do, you'll see that poll shortly. And the poll is asking a great question, which I can't see on my screen. But, oh, the next slide, which is really, where do you live? So we have people signing on from all over the country. So tell us where you live. Pick a letter. And when we can tell that most of you have given your answer, we'll be able to see where people are coming from. We've got about half of you, so we'll see if anyone else wants to throw in where they're from. Don't be shy. In a moment, we'll show you what everybody says. Poll is closing. Get your answer in. All right, so mostly Ontario, a couple of people from Nova Scotia, and the rest of the people are being shy. Hopefully you'll become less shy and more familiar with the polls as we move on later. I'm going to go on to our next little bit, I think. So I'm going to sort of talk for a few minutes about some of the research we've been doing on healthcare for people with developmental disabilities. The research is based out of Ontario, but having spoken about some of these findings to people from different parts of our country, I know that probably the things I'm going to be talking about are not unique to one province. So this image is a report that we published in 2013, and it's part of the H-Card program. And what we did in this study is we looked at adults with developmental disabilities across Ontario. And really we wanted to find out how are they doing in terms of their healthcare, particularly their primary healthcare, relative to every other adult of the same age in our province. So I'm just going to highlight a few key findings to kind of point out why it is that we need to be talking about health and healthcare communication. So this first figure, and don't worry if you're not big on statistics or research, I'll help walk through what all these things mean. We've got two bars. Our sort of turquoise bars show us how people with developmental disabilities are doing, and our red bars show how people without developmental disabilities are doing. And this is telling us different types of healthcare problems that go on for people with and without developmental disabilities. And what you see when you look at this is that for the most part, our blue bars, our turquoise bars, are higher than our red bars. So for almost every healthcare condition, it's more often occurring for people with developmental disabilities than people without. And you might be drawing your attention to the last set of bars, which are focusing on psychiatric disorders, which are incredibly common in this population. Now, this slide shows us how people are doing in terms of the healthcare that they use. And this is just looking at 1 year. In a year, how likely is it for people with and without developmental disabilities to see their family doctors, to go to the emergency department, or to be hospitalized? So what we see is that similar rates of people with and without developmental disabilities go to their family doctors or have primary care. You might think, well, that's not bad, that's pretty good. But we do have guidelines in our country, across our country, that say that people with developmental disabilities should be going not only just once to see them, but for an annual health check every single year. So we really do want to see 100% here and not 76%. But the other thing you'll notice is that the likelihood of going to the emergency department or being hospitalized is higher for people with developmental disabilities. So we need to be thinking about how we care for these individuals in those settings, and also what are the things we could be doing to potentially prevent some of those kinds of visits. Now, I'm going to show two figures that highlight what's going on in terms of medications. And this is based on information for people in our province who get ODSP, which is the sort of funded sort of disability supports that include payment for your medication. And we looked at about 52,000 adults with developmental disabilities to see how likely they were to be taking any medications at all. And what we see here is about 2 in 5 of those people, or 40%, were not taking a medication, which means that the other 60% were. And in fact, what we see is that most of those people were taking 2 or more medications at the same time. And about 20% of people were taking 5 or more medications at the same time. Now, what kinds of medications were they taking? This figure shows us the red bars are for what we call psychotropic medications, or medications you would take for psychiatric concerns. The blue bars or turquoise bars are for physical health conditions. And you see that the red bars are bigger and there's more of them. The most commonly prescribed medication in this population, and this is not what we see in the general population, are antipsychotics. The second most commonly prescribed medication are actually what we call either anticonvulsants, which are sometimes given for seizures, or mood stabilizers. So after we did that report in 2013, we kept looking at what was going on around healthcare in this population. And just about a year ago, we wrote another report which looks at concerning healthcare outcomes. And I'm going to show you one infographic capturing what we learned in this report. And all of these reports are available to people online, and we have videos and simple explanations of them, which you're welcome to find more information about after this talk. But let me show you what we learned when we followed people with developmental disabilities, the same group of about 66 or so thousand people over 6 years. What happened to them compared to people without developmental disabilities? We looked at 5 what we call concerning health outcomes or healthcare gaps. The first one we looked at isn't just going to the emergency department, but going to the emergency department and coming back within less than a month. Okay, so we consider that to be a really concerning issue, because it means that maybe when you left the emergency department, you didn't get the services you needed in the community and you had to come right back. And what we see is that people with developmental disabilities are almost 2 times as likely to have that happen. Okay, so about a third of adults with developmental disabilities visited the emergency department twice within a month over a 6-year period. Okay. We also looked at what happened in terms of repeat hospitalization. So again, if you are hospitalized, which does happen, what we want to see happen is that you're ready for discharge, you plan a good discharge, you go back to the community, and ideally you stay in the community. And what we saw is that people were more than 3 times as likely to have a repeat hospitalization. We also saw, and we call this in Ontario, alternate level of care, that people with developmental disabilities were more likely to be in hospital as inpatients and not be able to get discharged, even though they were ready to be discharged. So 6.5 times as likely for that to happen to them than other people. But they were 17.5 times as likely, although the overall rates are fairly low, to be living in long-term care facilities. And these are all people who, in 2010, were under the age of 65. And this is the one that concerns me the most, is that they were almost 4 times as likely to die over those 6 years compared to other adults. These are all adults who are 65 and under in 2010. We followed them for 6 years, almost 4 times as likely to be dead in that time. And that's why we think it's really important for us to be talking about healthcare in this group and to be thinking about things we can do to change the situation. Now, what I'd like to do is show a little bit of a video that just captures very quickly common sort of healthcare scenarios that can happen with this population. And I'm proud that we have actors with developmental disabilities in those scenarios. And I think when you watch these, some of the things, unfortunately, may feel a bit familiar. So I think, Irfan, you're going to play that for the group.
Victor, I'm Dr. Lee. Look, I heard you were screaming on the streetcar. What was that all about, man? Victor? Victor? Hello, so I need you to answer some of these questions, the police brought you here, and you basically have to answer some questions, otherwise you can't leave.
I want to leave.
So let's get this clear. You're not allowed to leave until we talk a little bit here, okay? You hear me?
I want to leave!
Victor, settle down, okay? You hear me?
I want to leave, please! I just want to go home!
You need to settle down right now, okay? Otherwise, I'm going to have to call security.
I want to go home!
Victor, settle down.
I want to go home!
Security.
Just okay? All right. So let's get this done. You see your arm? Okay. Right. So just relax. I'm going to make this as quick as I can, okay? Oh, okay. You got to keep your arms straight, all right? And try to relax, okay? Oh, okay. No. Just
give her a second.
okay. I have other people I got to do.
I know, but she's really scared, so just give her 1 second.
Okay,
all
look,
right?
let's get this done as quick as possible. Okay, so keep your arms straight. Okay. No. Okay, I'm just going to wipe this off and get it done quickly, okay? Try to keep it straight. No. All right. Okay, I can see you're upset. You gotta relax, or else I can't do the blood work. Okay? Let's get this done quickly. Great. No, keep it straight, please, and then we can get this done quickly. Okay? Are you crying? Oh, okay. I'm gonna have to come back, okay?
I think he's got an ear infection,
Okay.
and I've got some antibiotics that I think he'll need to take, and I'll just give you a prescription for that,
All right.
and maybe we'll arrange for you to come back and be re-examined in about 1 week.
Okay.
Okay?
All right.
So I've got that prescription, and just on your way out, you can make arrangements about it.
Okay.
So 3 common scenarios, unfortunately. One, that person just really not being able to contain themselves and not being well supported in the emergency department by themselves. Having to get a blood draw done, but not being able to be calm enough to do it, and an exasperated nurse kind of giving up. And having an appointment with a family member where the entire conversation is directed toward the family caregiver and not Bill, who's right there in the room. So we have another poll coming up, because I think we're interested in how often some of these things might happen, Chief. So 2 simple questions. Try to respond to these fairly quickly. There's only 2 choices this time. For fun, I'm going to go to the poll. First question is, do you attend healthcare appointments with your family member? So for those of you online, let us know if you would go to those appointments typically with your family member if they go on there. And the next question, because you're going to see 2 polls, is have you ever taken your family member to the emergency department? Remember, I was saying that in Ontario, about 1/3 of people would go once within the year. As soon as you respond to those questions, we will show you our survey results.
We're about halfway there right now in terms of number of people who've come in with their answers. Okay, we're going to close the poll in a couple of seconds. Please send in your last answers, please. Okay, and we have our answers. So about 49% of people said that they do, 49 people out of the 84 attendees said they do attend healthcare appointments with their family members. And in terms of taking people to the emergency room, we have 42 people saying that they have. And there's not a lot of answers towards the no. Most people haven't had a chance to answer.
Great. So I'm now going to invite Lee, I think, to come and speak to us about some of these issues.
I just really like this slide. As much as possible to create the choice and means for expression that honors and validates the person themselves. As caregivers of children, we have become excellent advocates and spokespeople for our loved ones. But as our children age, it's important to empower their own abilities in whatever way that they can express themselves. And I think the tools that we're about to talk about today really provide that opportunity to have their voice in whatever means that is expression comes about. So it's exciting now to share these tools with you.
So we just put down sort of 5 bullets around how we think some of these tools might be helpful. I think really building off of what Lee said, you know, be my microphone, not my voice. We need to find ways to amplify that voice in healthcare settings so that people with disabilities aren't ignored, and make sure that no matter what they can say with words, that they are at the center of all healthcare that concerns them. So using these kinds of tools can really help with the information going back and forth, because it is an exchange between people getting healthcare and the healthcare providers. But also these tools are an opportunity to say, this is something that would help me make my visit go better before the visit actually starts. And it also is a way of tracking what happens over time, because it's not just like one snapshot healthcare visit, one snapshot healthcare visit, but how we look at everything over time for the same person, and also to make sure that when we get our healthcare, that there's a similar sort of consistency in terms of how we do that across providers. So I'm going to ask Irfan to come up and speak a little bit more about the 2 tools in particular that we're focusing on today.
So the 2 tools that we have, I'm just going to show all of you guys how to access the tools. They're available on the DD Primary Care Surrey Place website that we have on the screen here. So if you went into ddprimarycare.surreyplace.ca, this is the landing page that you'd see. If you guys can see on the left, there's an area which says Tools for Primary Care of People with IDD. So we're going to go and click on that. And on the next page, this is what you're going to get. You have the green bar on the left-hand side, and one of the first tools over there is About My Health. So once you click Primary Care Tools, one of the first tools there is About My Health, and that's the first tool that we're going to be talking about. The one thing I will say about the tools starting off is that these are tools that are PDF versions available online. You can print them out and fill them by hand, or you can type in all your information and have it saved as a record for you going forward, and then you can edit that pretty easy going forward as well. There's also examples that are available on the website. And again, I'll speak to these 2 things as we go through. Okay, so the first tool is About My Health. And a little bit about this tool is this is a tool meant to capture overall sort of almost like a mini passport with regard to healthcare information about a person. This is about who your loved one, so if this is your sibling or your child, is as a person, what is important to them, important life experiences that they've had, and some important strategies that could help healthcare visits go better. So we'll go through a couple of the sections in these tools, but this is a great tool to be sharing with the provider that you're meeting for the first time. We recommend sort of updating this tool on a yearly basis, just whenever any changes do happen, just to make sure it's the most up-to-date information. A very useful tool in terms of getting somebody in healthcare to be able to learn about your loved one in a quick and easy manner. Everything that they need to help facilitate a better healthcare interaction. So at the top, you can see we have sort of some demographic information. And then number 2, as you can see in the middle of the slide here, says things I want you to know about me. So the first thing here is my interests and what I like to do. The reason that's on there is to sort of build some rapport and have some information that can help healthcare providers have a great conversation, start breaking those barriers, have a little bit of an icebreaker and get some headway in terms of communication. Important people in my life. Those are things that, again, you want to highlight that who are the important people for your loved one who should be involved in anything going forward decision-wise. And difficult life experiences I've had that I want you to know about. Again, this is a tool that you need to use as you see fit. Some people find that it's helpful to have these things written down, but at times this could be a little bit of an emotional experience even filling this out. So you have to do whatever you feel comfortable, but this is a great way to share some information around some difficult life experiences that may affect future interactions. So a way to share some of that information upfront so that your healthcare providers are aware and then can give you some care for you in a way that is appropriate based on those life experiences. Make sure that they're knowledgeable and cognizant of those things. I'm just going to keep going through the other sections. At the bottom, there's like emergency contacts. So those would be people to contact in case any sort of anything were to happen. Some other things that are on the About My Health tool are some communication strategies. So you can see at the top, the middle of the slide here, things that you can do to help me understand. And the me that we're speaking to in this case is the person with intellectual disability, so your loved ones in this case. And this is a tool that you'd be filling out with your loved one, and they will be, it's like a process where like you'd be together identifying things that have worked in the past and can help visits go better. And the idea is for this to be shared at the beginning of visits to make that particular visit go a little bit better. So things such as speaking slowly, using a caregiver or staff to help make certain explanations using pictures, whatever it is, the strategies that work best for you. There's also some things around helping certain difficult procedures, things like blood work, imaging, certain things, strategies that have found helpful for some people. And you can also have, there's another section where you can identify other strategies in there as well. And then right at the bottom of this slide, we have things that I like at healthcare visits and things I don't like at healthcare visits. Again, a chance for your loved ones to share what it is that is concerning at healthcare visits for them, what are they anxious about, so that certain steps can be made to avoid and quell those anxieties, and things that I like at healthcare visits that can be, positively reinforced and keep being done again and again to make visits go better. Because again, we do understand that healthcare visits are not fun for most people, and how can we do this thing in a better way for everybody? So that's a broad overview on About My Health. Again, we haven't gone through all of the different sections on there. This is an example of a filled out version. Again, this is available on the website. Provides you with some information on what are the things that should be included in certain sections and give you some ideas to sort of get your mind going in terms of what you should be putting in certain sections. That is that for the About My Health tool. The second tool that we're sharing today is called My Healthcare Visit. And this is a tool that's more focused on a particular visit, and you'd fill one out for every time you'd go for the visit. And that focuses on why are we having this visit today and what are we going to do with it? And that'll become a little bit more clear as I show you the example. Again, like before, the bar on the left will show you where the My Healthcare Visit box is. This is on the same website as before. And there's a version that you can download that's blank, as well as an example version. So My Healthcare Visit has two sides. The first side of the form has a little bit of demographic information at the top, some reminders of things to bring with you and identifying what type of appointment this is. And at the bottom, there's a huge open text area where you would highlight what is the reason for the healthcare visit today. Are you having some stomach issues? Is there some issues with breathing and a lot of coughing, sneezing? Whatever it is that's bothering or there's the concern that's not going to be addressed at the appointment, this is an area for you to sort of provide some of those details. In addition, you can also provide a tracking sheet if you've been tracking some of your symptoms. And at the bottom here on this slide, we've got a number of different symptoms that tend to be fairly commonly reported in people with intellectual and developmental disabilities, where you can say that, okay, this is also a concern that has been coming up. You can provide some detail around it. And if you have some tracking information, this would be good to attach as well. And we'll show some examples a little bit later on some tracking information as well and what that may look like. Okay. So that was the one side of the My Healthcare Visit tool. And then the second side of the My Healthcare Visit tool is to be filled out by the provider, whether it's the physician, the nurse, the social worker, whoever it is that you are visiting. And at the top, they'll provide a little bit of a summary around what it is that we talked about at the appointment and what next steps are. And this is great because it serves as a record of the appointment for you, for your filing purposes and for your record keeping purposes, where you know exactly what was done at each appointment, you know what steps were taken, and what needs to come next. So whether that's things like having some blood work done, getting some imaging done, booking a referral, booking an appointment with a specialist, or making a referral, following up on a referral with a specialist, that would all be captured in this form, as well as any new medications that are being prescribed. And here, right at the bottom, there's some additional information around reminders of making sure that this page is completed and scheduling any next steps that need to be done. And finally, right at the bottom of that second page is an area we can provide some comments around the visit. And again, this is a great exercise for you to engage with your caregiver, with your loved one, and just take a little bit of a reflective stance on how the appointment went and whether things could be done differently for future appointments or things that you really liked and you'd like to do again going forward. So just again, an opportunity to sort of learn from experiences and take that forward. Okay, and like before, this is a sample version available on the website, which we have filled out. And again, we're available to via email or via phone call. We'll share those details later to help people fill out the form and use the tools to the best of their abilities. Another tool that's sort of available online is like the seizure action plan. So this is a specific tool, again, on the same DDPCP website, primary care program website, which provides some more information for a particular targeted area. In this case, for somebody who has seizures or epilepsy, it provides some information on what types of seizures this person experiences and what are the next steps to take if they do end up getting a seizure. So this is helpful for somebody who doesn't know your care loved one as well, to be able to identify what would be the right next steps in that particular scenario, who would be the right people to contact in the event of a seizure. Okay, and I'm going to pass this back to Yona to talk a little bit more about some family toolkits coming up.
Thanks, Irfan. So hopefully everyone's still with us. No one's disconnected so far. People are enticed, enjoying the webinar. This is just a sort of visual for you. As I said, some of this work has developed, well, all this work is just developed through partnerships and engagement over time. These tools that we just shared were developed through a lot of engagement with folks from VITA Community Services, so people with developmental disabilities there, with staff who work in that agency, as well as a number of families, some connected to VITA, some connected to other agencies, and some just part of the broader community, who've been giving us feedback on different iterations of this tool. And we also looked at what healthcare providers wanted and tried to figure out what that happy medium is in terms of capturing the right information. So we have a toolkit right now that we've developed with these tools and others that are for staff who work in the sector, and we're just getting ready to post similar tools that we've developed for families. And so this website is not live. It will be very soon. And when you click on this link, you'd be able to go right to I'm a Family Caregiver. You'd see the tools we just showed you, as well as a number of other tools and resources that might be able to help you. So this would be an example of a tool looking at issues around aging, as well as dementia, information that might be valuable to you. Here's another monitoring chart from the primary care program if you want to be able to monitor what's going on in terms of somebody's menstrual cycle. And these are different types of handouts you'd find on the toolkit to help people with disabilities sort of feel more empowered around certain kinds of cancer screening procedures that they may be involved in. So the PAP, the mammogram, and the echo-BT testing. Okay, so I think it's time for another poll. We have a couple of questions here. One is, what system does your doctor use to record information? Are they using a paper chart? Do they type all the things on their computer, or you have to put that down as your first question that you're seeing on the poll on your screen? And we have another question here, which has to do with how comfortable you are when it comes to filling out different kinds of forms within healthcare. So see if you can respond to those two polling questions, and we'll look at those results. Then we'll talk a little bit about what all of this means, and sort of Lee will talk in particular about her experience using some of these tools.
So we're about halfway through the polls in terms of number of people who've sent in their answers. Thank you so much for answering. We just encourage a couple of you more to send in your answers. We'll be closing the poll in a couple of seconds, about 10 seconds from now. Okay, in terms of our results, we have about 10% of people said their doctors still use paper charts, and 47% of people said their doctors use electronic medical records, and about a third of you, so 38%, said they haven't provided an answer, and that's okay. And then for the second question on how comfortable people are feeling using different tools, about 10% of people said they're very uncomfortable. Neutral, we have about 6% saying neutral or somewhat uncomfortable. Somewhat comfortable is about 22%, and very comfortable is about 20%. And 40% of people haven't had a chance to answer.
So what we want to do is sort of share some experiences collectively that we've had, because we've been using these tools now for some time. And we're going to start with Phil.
Thanks, Yona. So I found that these tools empowered my son to think about information that's helpful ahead of time when he was calm. It provided an opportunity to hear the strategies that would help the visit to go better, coming straight from him, and with some prompting and help from me, saying, well, remember when we did this, that was helpful. Oh yeah, that's true. And together we filled out the forms. It created an opportunity to record everything in a file so that if this information is repeated at numerous locations, that it's everything is expressed in one place, so things don't get forgotten. So that really helps the healthcare provider, but it also empowers us as caregivers and also most particularly our loved ones. So the tool about preparing for the healthcare visit, that one my son found fairly straightforward because it was only one page that he had to complete. So he was thinking about, well, he has to go for a physical with his doctor soon, and he would also like to get an update on his diabetes. So the section, have any of these been bothering you in the last week or longer? That highlighted Eric's concern about that he was having headaches more frequently. It highlighted that he hasn't been sleeping as well, his worry about his diabetes getting worse again, and him needing to go back to injecting insulin. And together, it was reminded that it had been October 2018 since he last actually had to have an insulin injection. And he wouldn't maybe have remembered when he last had insulin. But it also highlighted me as a caregiver how much this is on his mind, this worry, because he was able to express that himself, and we were able to document it right on the form. The second part of that document, the second page, completed by the healthcare provider, would capture next steps. So even if Eric attends an appointment without me, there's a place to have a written instructions in case Eric forgot some of the instructions or didn't understand the instructions completely. And I like the fact that there's a place to note further appointments. And then at the bottom of the form, the space to complete after the appointment to discuss what went well and what could have been done differently. That was a discussion we can have when he comes back from the appointment, or we can go for lunch after the appointment and just to talk about, well, hey, how did that go for you? What could be improved? The About My Health form, that was the second form that Irfan showed. And this form took a little bit more time to do at home. But a lot of good questions came up, some fears came up, and some great discussion points for me as a caregiver. So in the question, difficult life experiences I've had that I want you to know about, Eric answered, I've been mistreated by society. And that was really challenging for me to read, but it's also a red flag that Eric is struggling emotionally. And although I know that, because I hear it in how he speaks, this may not have come up. I was thinking when he goes for that physical examination, you know, when the doctor might say, you know, more generally, how are you doing? He probably would have said, all right. But the fact that it was actually captured in writing, in his own handwriting, that he feels mistreated by society, I think is a powerful red flag for a doctor or a healthcare provider or social worker to delve into that more deeply. To the question, important people in my life, Eric identified 3 friends. Interestingly, I'm not considered an important person in his life, but not as, I didn't take that as, wow, like how come I'm not in that list? For me, it was the fact that for Eric, how important are relationships? And the 3 friends he listed, none are actually active in his life. So I found that really kind of, one has moved away, one is barely in touch, and one is traveling. So to me, that really highlighted that most of the people in Eric's life are paid workers. And it was also an opportunity for me to think about and reflect. I need to bring his circle of support back together and identify ways that Eric could be more in the community, opportunities for new friends to be made. So that too was a bit of a challenging question for me as a caregiver to see what his response was. And to the question, identifying someone to help me make healthcare decisions and someone I would want to be told about appointments, his answer to that first was, I don't know. And I said, well, Eric, I would always come with you to appointments or help you make healthcare decisions. And his answer to that, again, was emotional, that he actually said, but then what happens to me when you're no longer here? So again, I just think these questions that this form provides are provocative questions for us as caregivers to delve more deeply into, because it highlights fears, it highlights concerns, and so yeah, I think that's just was really my experience of completing the forms. So some of the challenges that we identified, and you probably have your own challenges that you'd come up with, are, our doctor doesn't use paper forms, or I'm intimidated that our doctor doesn't have time. I actually think my experience would be that tools like this can actually save the doctor time. Helpful information is captured in one place, copies can be made, kept in their files, and it's a secure place to capture follow-up instructions that the doctor or healthcare provider would provide. The next one, my son can't speak and would not be able to fill out these forms. And I was really thinking about this one because I'm lucky enough that Eric could express some of these things to me, but I know many of us don't have, their loved one maybe can't express in the same ways. But filling in these forms, it's an opportunity to talk about that interdependence. And I expressed to him when he was filling it out, like, I need help going to the doctor, and I like to take somebody along to an appointment and help me complete forms because I may miss something. So this idea of just interdependence that we all have means we all need to have that type of support. And at the same time, though, I think it gives individuals who are, that they're front and center, that it's important to address their feedback of the individual themselves, not just, as was said earlier, that, where, and illustrated how healthcare providers can sometimes talk to the person who's accompanying versus to the individuals themselves. So I just really like that it puts the person front and center, their voice to the best of their ability. And I use that voice in the broadest terms of communicating. This next one, my doctor goes to appointments alone. I'm not allowed to attend. Well, I have firsthand experience with this, where, it's assumed that Eric's an adult now, and so I should not be there for the whole appointment. So these forms allow me the opportunity to capture information as a caregiver I want to make sure that they know about, and it ensures the instructions that come back home are in a written form, that important information and instructions aren't missed. So as much as I want to empower my son to be as independent as possible, I also know how important it is that things could get missed, really. And so how do I both empower him and ensure that he's cared for and those instructions are as complete as possible? So this next one, my brother wants to be independent and doesn't think he needs help. Again, I could really relate to that. So again, honoring that independence provides an opportunity for the appointment to ensure that this key information is in a written format. So it honors their independence and at the same time makes sure that both they and we as caregivers have the information we need. And this last one, my sister usually goes to the emergency department or different hospitals that would never bring this form. So I was thinking about how these forms can actually be located in emergency. They could be located on file, and it would help staff know what's worked in the past, strategies that can be used to help the appointment or the procedure or whatever go as smoothly as possible. So those are some of the challenges. I'm sure you've come up with some of your own challenges as well.
And I think what we can do as part of the sort of ending part of our webinar is we specifically left some time for questions and comments. There may be things you put in the chat box about either a challenge that you can relate to that we mentioned or a challenge that you think wasn't mentioned. And if we have time, we can respond to some of that right here and now. And then the things that we can't respond to, we can in a sort of summary that we'll send out after, give feedback on. Just to say around the issue of paper forms, that's certainly a barrier I think that some people encounter. Like some doctors are just like, oh my gosh, one more piece of paper. What am I going to do with that, right? So we are looking at these forms we've talked about can be filled out on PDF, so you can type the answers in and then you can just update them and save them on your own computer. That doesn't mean it's compatible at the healthcare setting where you're going. We are working closely with Ocean MD. We're actually making a tool that is sort of pushed out by the doctor. So imagine that you would, I don't know if any of you have this right now, where when you go to see a doctor, there's forms that are sent to you on email and you sort of click, 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 or you fill out a tablet while you're in the waiting area, and then that gets uploaded right into the health record. So we're looking at having this kind of form, same information, but in that format, because moving forward, I think we will have less paper. We have to keep in mind that different people learn in different ways, so it may be helpful to have something that's electronic at the healthcare provider's office, but for your own records, some people still might like to have either those pieces of paper or something that they save on. So I think where we're at now, so we do have some really interesting comments and stuff. Irfan's going to highlight a few and we'll see if we can respond to them.
So one of the comments that we have from Jay Spicer is saying that, yes, Lee, I think this will be a great way to express info when it's not a threatening situation. Followed by such amazing and personal insights. We should all start using the tools way before we think we need them.
That's such an important point, hey? I think, and I've done a lot of my work in the area of emergency departments, and believe me, that is not the time to fill out any forms, right? So it's almost like, you know, when you're expecting a baby and they say you're supposed to have this bag that's just ready to go. That's what these forms are as well, right? So you know you're planning an appointment in advance. Think about, talk about, like we said, have that discussion about what you want to cover in that appointment. Get ready together as a family and bring that information. And then know if there is an emergency and you're not ready for it, you've got this other thing that really captures who your brother or sister or son or daughter is that can go to any of those appointments, because it is very hard to think about that information in a more urgent situation.
Or like the About My Health, I think captures that. If you're updating it regularly, it's ready to go whenever, just like that baby bag that we're talking about. It's ready to go whenever you're ready for emerge. It's ready for you as well. So it's a great point that you bring up. Another comment that we've had now is saying that I would love to hear about your thoughts on digital health. Are there ways it might help to facilitate some of these interactions?
Yeah, I mean, I think digital health is moving and advancing all the time. It's so exciting. And I think what we want to need to make sure is that this population is not left out of what's happening, right? So there's different kinds of ways. For example, if you're filling out a form and you can't read it, digital health can also sometimes help in terms of it can be read to you, right? Or there could be images that go with it that you click on. So I think there's a lot of things we can be doing, but we don't want to be left out of digital health. So I think anytime we see things that aren't accessible to us or to people in our family with disabilities, thinking about ways to sort of innovate and make them more accessible. The world is changing, I think. I think that's a really good important point. So we realize these tools like this, I don't think exactly what we're showing you today is going to be the same thing we're going to be showing you in 5 years. I think the kinds of questions we come up with are really consistent. And we've done a lot of work sort of leading up to this sort of group of questions and as well as how we'd ask them. So I don't think they'll change in a huge way, but the platforms that we use to share information hopefully will continue.
There's another comment that we have here saying that I know my GP will embrace the forms and will likely share the access to them. I see how I can use this form for my elderly patients with dementia. Sorry, parents with dementia, my bad.
Yeah, I think it's a really good point that, you know, when we think about tools and sort of usability of tools, the more like, this is before, you know, if we have 30 agencies in one community and every agency has their own form, what that means to the healthcare provider is, oh my gosh, I've got to go find the information on this form. Like we want something consistent for our community, but also useful for other communities. And in fact, when we shared this tool, we've heard that very same kind of feedback that I could use this with these other patients, right? So nothing wrong with that, because the needs we're identifying here are many people's needs. And the more common, the more used to people get to having information like this, I think it can improve everybody's health.
Yeah, it's just that prep work in the beginning that helps everything from that visit go a little bit better. There's another follow-up comment. As I walk into each of my son's appointments with my big, huge binder of info for the past 20 years, I would like to help my adult son develop his own binder.
Absolutely. And it's so interesting, right? Like, bottom line, please don't throw out your binders. But I know, for example, first of all, whose binder is it, right? So we're transitioning with our kids having the binders that we carry as parents to really working toward people having their own binders, or Lee, what you mentioned about that sort of interdependent, sort of shared collective binder. But also knowing that people don't always have time to look at your whole binder. That binder is for you and you need that information. But I will say again, working in emergency departments, They don't want the binder. They want the, if you know this expression, the Coles Notes version, right? They want that shortened version that's relevant to them at this point of care. So it is helpful to know how to sort of get that information captured for different groups. So if it's an in-depth consultation, they have a lot of time. It's great that you can pull out stuff from the whole binder. But sometimes people just need sort of certain information, and we need to make sure that information is updated. So really the point about the About My Health and making sure that the information on it is still the right information, super important in case there's an unplanned.
And the last, I think we have another comment here saying that, do I need a guardianship to be involved in my loved one's care if she's not able to take a decision?
Yeah, I mean, that's a whole other topic in itself, and we could see about, and like, feel free to use the chat box to tell us in the survey after what topics and things you want covered. You know, if you go to the doctors and you're getting some really serious information about, you know, a cancer screening diagnosis, you know, are you the only one allowed in the room? Whether you have a guardian or not. So I think there's guardianship, which is currently sort of a legal process that some people go through. But there's also something that we call supported decision making. And often we all need support when it comes to certain decisions. So I think, you know, I would advise, and certainly I heard this from you, Leah, as well, that you want to think about these tools as ways to sort of think about who are the important people to be in the room and how can we make some of these decisions together. Not so much like, yes, they can make healthcare decisions or no. Some people can make certain healthcare decisions sometimes and not other times, or not other types of healthcare decisions. And people require different levels of support for each decision. And this is kind of a way of bringing people together to keep that person included as much as they are able at that.
And we have another comment here. We have vulnerable sector screening for police. Would it be nice to have a similar flag for hospitals in event person ends up at ER or hospital without a family member? This tool can potentially be part of record.
Yeah, it's a really important point. Some people are big on the sort of vulnerable persons type registries that we have with police. There are all different ways to do this. And again, I mean, I'll talk about this because I've been doing research on this for some time. I don't think there's one way to do it. You know, some people are really fond of wearing a medical alert bracelet, for example, which you can also update and give lots of information to be available on a computer. Some people are going to like this tool. Some people have a way of getting this tool into the emergency department before an emergency. So one thing I always say is if you've had an emergency, given how many people I said are likely to come back, you want to have that tool in that emergency department. In our province, we can share information across hospitals. Some things that are uploaded are accessible sometimes without you even having to get permission. It's just available in the record. Other things you'd have to get permission to be able to look at it. So think about where you live, how that information can be shared. You know, whether it's this kind of format. One thing I would say about the Vulnerable Persons Registry is some of the items, some of the topics are similar types of topics to what we have in these forms. I think equally important to the information, how we capture the information. So thinking about who is at the center there, who's the question about, what's the language that we use to get those questions answered, and what information do we want shared about ourselves and so, but yes, I think it is really important for us to be thinking about in healthcare, how do we want to make sure that people have the information they need to give the very best healthcare possible? There'll be different solutions for different people. So, yeah, I don't know if Lee, if you had anything you wanted to comment on, or Irfan, or if anyone, we have our live room here. You guys can't see everyone, but I don't know if there are any additional comments or questions.
I guess just what really struck me when Eric was diagnosed with diabetes was just how the healthcare providers made the assumption that he had a great understanding that I certainly didn't want to say in front of him. I don't think he's picking up all of these instructions you're giving him, all of this medical knowledge, the mathematics in like giving insulin and carbohydrates and all of that. So I needed a way of honoring his independence and still making sure he was safe that I understood. And I just didn't know about these tools at the time, but I think that they are the bridge. They could be the bridge between still saying, yes, he's a 28-year-old man and he wants to be as independent as possible in these appointments and save emotional face, that he's scared to death inside, but wants to look like he's taking all this in and he's being brave. But what do we need in our hands when we leave that healthcare appointment and be able to give him the best care possible as his mom, as other people that are supporting him? And this is where I really felt like I didn't know this tool existed, but now I think, wow, just to be able to have them in his own words, in his own handwriting, say, this is what scares me, this is what helps me, this is how much information I can take in, these are strategies that you can use, that just puts the empowerment back into his hands, but also it's a real key discussion point with the two of us or others who are caring for him to say, you know, what about this? Remember that worked before. Okay, let's capture that. Let's put that down somewhere. Yeah.
And maybe just to wrap up, I think those are really, really important points. And we want to make sure that we can spread this information. So think about how you can give us the feedback that you have on these tools, and also about other people you might want to be sharing all of these things with. I think the more we're speaking a common language, the more we can support people. Now, you'll notice this presentation was really targeted towards families. We have funding from the SPOR unit in Ontario through an Empower grant to sort of do our work sharing some of this information. We've done a similar kind of presentation for staff who work in the sector, and we're most excited about a similar presentation that we're going to be doing for people with developmental disabilities, led by people with developmental disabilities who've been working with us in the program and working with these tools. So if that's something that's of interest to you, certainly let us know that you know, in the feedback bar or in the survey that you're going to get after this. So just to end, if you liked today, March 3rd, we talked about communication. We have 3 more topics in our Azrieli Learning Series that brings us up to the summer. And we'd love it if you were interested in joining us for the other 3. So we'll be talking about more specifically assessment of mental health concerns, treatment, a sort of introduction to treatment issues, sort of an overview. And then also, maybe I'm most excited about this one, with Lee, we'll be talking about different sorts of aspects of self-care and the way we take care of caregivers. And just to say, because I know some people say, I hate this idea of self-care, that there's much more that I need than just taking care of myself. And I think it's not so much that you have to do it by yourself, it's that the care has to be for you, as opposed to for the people that you love and support. So we wanted to thank everyone for joining us today. Again, I've acknowledged the funding that we got from the Ontario SPOR Unit. This project is part of the Azrieli Adult Neurodevelopmental Center here at CAMH, and it's also part of the H-Card program. And if you like the videos that you saw, we have educational videos for people with disabilities, for families, for healthcare providers. You can see more of those on our YouTube channel. You can check out a whole bunch of tools that we've developed, and please stay in touch with us and we will share more information with you. And stay tuned as well. You will get a survey right after this, and we only know how we're doing if you fill out the survey. So we will post the video of this webinar so that people who missed it, or in case you loved it so much you want to watch it again, it will be available to everybody on our website, and we would love to get your feedback and hear more from you. So I think with that, I want to thank, I guess, everybody, me, Irfan, all the people behind the scenes. For those of you on the webinar, you can't see all the people in the room that have been helping us so hard to prepare for today, for this webinar. So thanks everybody for that, and ED Health Matters. Let's do more to make everybody's health better.